Welcome to the Brain Spine Neurosurgical Institute. Our goal at BSNI is fairly simple. We want you to have a thorough understanding of your condition. Patients often leave their doctor's office confused and with many questions. We want you to have an effective knowledge of your diagnosis and your course of treatment, so that together we can work as a team to address your concerns. Today, we are going to discuss the laminectomy. Let us start by reviewing some simple anatomy. The spinal cord, seen here as a group of closely packed thin yellow strands, is a collection of nerves that extends from the base of the skull. The spinal cord is surrounded and protected by the vertebrae of the spinal column. The back portion, or posterior spinal column, is made up of the laminae, stacked one on top of the other. As we move downward along the spine, we reach the cauda equina. Here, the nerve roots begin to separate as they extend outwards from the spinal column and into the other parts of the body. In certain instances, the lamina will become slightly displaced and push into the spinal canal. This displacement may result in the vertebrae pressing against one of the nerve roots and thus may cause the patient pain. The narrowing of the spinal canal is known as spinal stenosis. Here, we see a bird's eye view of the spinal canal. Clearly, the spinal canal on the left is narrower than that on the right, and thus can be diagnosed with stenosis. Patients presenting with spinal stenosis often experience pain in either their arms or legs. The location of the pain is based on where along the spine the obstruction of the spinal canal occurs. Each spinal nerve connects to a different part of the body, and thus a variety of different scenarios may present themselves. Specifically, disturbance to the nerves along the top or cervical vertebrae commonly results in arm pain. Similarly, if it is the nerves amidst the middle or lumbar vertebrae that are afflicted, leg pain is the most common symptom. The procedure is done with the patient lying on his or her stomach. A vertical incision is made at the site of the spinal cord impingement. Surrounding muscles are held aside to gain access to the laminae. A drill is used to remove the portion of displaced bone. Other instruments are used to relieve any pressure on the nerves and return the spinal canal to its healthy form. The incision is then closed and the procedure is complete. The procedure will last between 1 and 2 hours, depending on the number of affected spinal nerves. In most cases, laminectomies are performed as outpatient procedures and patients return home the same day. Patients can expect to be walking shortly after surgery. Pain due to swollen nerves is common for about 2 days after the procedure. Hopefully, this will give you a better understanding of a laminectomy. The procedure is safe and very effective. If you have any additional questions, please don't hesitate to ask.